Perfect. So well, I guess we'll start off with an introduction here. My name is Jennifer, Jen most of the time, Thatcher. I am the coordinator for the Practical Nurse program here at Northern Lakes College. And we're going to spend, I don't have a long presentation for you, but we're going to spend a little bit of time just going through some of the information for things that I get asked quite often. So we always want to start off with, oh, this slide shifted funny with it's welcome with an E to your future. This is one of our favorite nights of the year. This is from Capping and Pinning, and it's a picture that we take every year. Capping and Pinning is like nursing graduation. And so what it is that you cross the stage in your whites. At the beginning of the evening, none of those folks were wearing caps, whether they're wearing their traditional nursing caps or some of the gentlemen prefer to wear ball caps. As you cross the stage, the chair of our department provides you with a pin to welcome you to the nursing profession, and our instructors will place the hat on the graduate's head. So that's a really special night for us when we get to participate in that really traditional ceremony with our graduates. So when we think about the practical nurse, there's lots of different ideas out there of what the practical nurse does. And as things are going these days, our scope keeps growing, and the opportunities for employment just keep growing right along with it. I kind of use myself for an example. For a background, I started off as a new grad. I worked on a medical unit, and then just because our family moved, I moved to a rural hospital where we did everything from kind of medical surgical inpatient. I worked in emergency, did some work in maternity. And then I decided I liked the maternity so much that I ended up working on a maternity unit. That's still kind of my side gig and my very limited downtime. I don't get to do it very often anymore, but it is certainly there and available. And then from maternity, I actually ended up going and working at a mental health clinic where I worked in the antipsychotic injection medication clinic and on the children's mental health preschool team. And after that, I decided to apply for a job at the college, and here I am. So there's lots and lots of opportunities for LPNs to work in the community, in acute care, in hospitals, wherever you have an interest. I think one of the things that's been really good to me is that if you decide that you need to change directions or do something different, there's lots of different areas that you can work, and it seems like a little bit of a different job, but really it's using the same kind of foundation. This is our health careers mission and vision statement. So the health program mission statement is to provide health education based on best practice to graduate safe, caring, and competent professionals. And our goal here as the health program's vision statement is to be the first choice of online health education provider meeting health system and workforce needs. So one of the things that we talk about here, just when we're talking about looking at this program, is it for you? Are you looking for a challenging and rewarding career in healthcare? And we talk about how the Practical Nurse program prepares you to be licensed, that's where the L comes from, enabling you to work as part of the healthcare team. It's something that some people don't know or don't recognize is that practical nursing is actually a self-regulated profession with a unique body of knowledge. We have our own standards of practice, code of ethics, competencies, and a societal contract to provide safe, quality, and holistic patient care. And you hear us say that a lot, that our duty is to provide that safe and compassionate care, safe and holistic patient care. That's what it really comes down to. And so it's something to consider. So our program in particular is delivered through supported distance learning and face-to-face lab components. This delivery method allows students to pursue your educational goals in selected communities. However, you might have to relocate for short periods to another community to complete your practicum or lab requirements. And pardon me, I just need 1 second here. I'm just going to mute myself for a moment. Sorry, I've been battling a little bit of a cold this week and it's just catching up with me. And so what that means when we talk about the supported distance learning and the face-to-face components is that you can't learn how to be a nurse, 100% online because you need those hands-on experiences. And so the classes that are online would be the classes that you would think of as traditional theory classes. So anything that you would go and you would sit in a classroom and you would have that interaction with your instructor. That's exactly what we do. You have that interaction with your instructor. It's just an online classroom. So our classes run on schedule, they're live. Students are absolutely encouraged to attend the live synchronous class because that's how you're going to get the most out of it. And then for the hands-on portions, then you would come into the lab or come to the community where your practicum is being held. So where is that becomes an important question. So currently we're running from 5 campuses. We have high level is right now we have a new cohort starting next year for year 1. They have been doing every other year starts. So we're going to graduate a group of high level PN students here this year. Peace River, High Prairie, Slave Lake, and Lloydminster are all annual intakes. So this year, if you're looking at starting, you've got all 5 of those campuses to choose from. We have full-time and part-time options for the program. Full-time is really full-time, and we're going to look at the courses here shortly. And then part-time, we've got a couple of different options. And so part of my role as the coordinator is to meet with some of the students who are interested in talking about going part-time and just kind of mapping out a plan that works for you. A lot of people are going to school after they have kids or needing to work at times. And so what we want to do is make a plan that's going to work for you to be able to be successful during your time as a student here. Currently, we've got 125 first-year students and 77 second-year students. So our program design is, I just want to touch on it here just a little bit. The content of the Northern Lakes College Practical Nurse Program, including the theory, lab, and clinical learning experiences, work from simple to complex, so from the known to the unknown. And this focuses on the individual in the context of families and groups. And the program is designed to be based on the faculty's belief about education, conceptual framework, and then of course it's supported by arts and science courses. The content is also designed so that the practical nurse basic competencies are met at the time of graduation. Program, course, and unit outcomes have been developed to guide students' learning. The CLPNA is our regulating body. And so if you're ever on the CLPNA website, it stands for College of Licensed Practical Nurses of Alberta. It has a competency profile on it. It has a code of ethics on it. It's got all of these different pieces that come together to make it a regulated profession. And those are the competencies that our program is designed to meet at graduation. This is the curriculum conceptual framework, and what that's looking at is our nursing process. And I know that this slide is a little bit small to be able to easily read some of the words on it. But if you're looking at the inside of it, we're talking about the nursing process, and the nursing process works from the inside out. So those pieces that are coming around the nursing process, safety, competency, leadership, professionalism, reflection, communication, critical thinking, those are all part of the nursing process. And then what we want to do is we want to incorporate the practical nursing profession, the client, the health system, and the environment. And that's what makes up our conceptual framework. Don't worry if this is something that seems a little like, oh, okay. It's actually part of our curriculum, and it's something that we talk about in one of our first nursing foundation courses. Does anybody have any questions, any comments, any thoughts before I move on? You guys are good? Okay. So this is the Northern Lakes Practical Nurse Program. I know that it's really hard to read on this slide here. I just wanted you guys to have a look at it, because when you look on the website, if you go to programs and then you go down to health programs and then you further go down to the practical nurse program, the next few slides here are things that are actually on that website. I just want you to know what they look like. So when you're kind of scrolling around wondering what's applicable to you, you kind of know what you're looking for. And so what we're looking at here is that we say that semester 1 and semester 2 is year 1. And it looks like this second semester here is a really, really long semester. And that's because there's a clinical at the end of it. So you do all your theory classes in year 1, and then you spend the last 5 weeks of that second semester, which runs from about the middle of April to the end of May, out in long-term care clinical. And when I talk about clinicals, I'm talking about when you would go out with an instructor and other people from your class, other students from your class, and you would actually work in the facility that you've been assigned to. And then the semester 3 and semester 4 is second year. And you'll notice that in both semester 3 and semester 4, there's nursing practicums. In year 2, those are acute care nursing practicums. So what that means is you might go to a rural facility or a rural hospital or a medical or a surgical unit. And again, you would go with your instructor and some of your fellow students and actually work on those units under the supervision of your instructor. And then this last one here, which is the last nursing practice called the Focus Practicum, that's just before you graduate. And you spend 6 to 7 weeks, it's a set amount of hours, working with a preceptor one-on-one. And so we match you up with somebody that is an LPN working, and you follow their schedule and you work with them one-on-one until close to the end of your practicum, you're doing a good part of their job. And so that's kind of our known that then you've got some readiness for practice on your own when you're ready to get a job. So the cost breakdown, again, it's really tough to read on this slide here, but we've got the fees are posted for this coming year for both year 1 and year 2. And again, if you go back to that practical nurse page and then you click on those separate tabs, the fees do come up for both year 1 and year 2. Second year cost breakdown looks very similar, and you guys can have a peek at that online. So how do you get into our program? What are the prerequisites? So it's all academic requirements, and they're listed here. I'm just moving my head around here so I can read it. Bio 30, you need a 60% or better, or if you've got credit in anatomy and physiology as a 60%, ANPY 0190, 60%, or bio 0190. I'm going to talk about those 0190 courses here in just a minute. English 30, dash one is 60%, dash two is 70%, or 0190 is 60%. And then math 20, 50 or 60%, again, depending on which tier of math that you have. So if you don't have those prerequisites and you think, you know what, high school is not my time to shine, I need to buff up on a few of those classes, that's all right. We have what are called college and career prep classes. And those are those 0190s. And so if you are interested in either the practical nurse program or I believe the paramedic program takes them as well, what you can do is you can take, if you need English, you can take English 0190 or math 0190 bio. And then that will meet that prerequisite if you don't already have it. Each course is offered in the fall, winter, and spring, and it's a one-term class. Something to note about the 0190 courses that as far as I know, they are accepted at Northern Lakes College, but they're not accepted in other institutions in a similar way that other institutions will have their own kind of prep classes, but they don't always transfer for admission to us. So if you're looking at a Northern Lakes program, I highly suggest doing the 0190 classes if you need the prereqs. The other thing that we have within the confines of our program is we've got university studies courses. And the university studies courses are taught by instructors from the university studies department. Some courses are synchronous, which means they have live online classes, and for some they're asynchronous. They're taught asynchronously. So there's no live online classes, but there's activities and assignments that are still posted and that you still complete in a timely way. Synchronous classes are not mandatory, but again, they're recommended to be attending, and recordings are provided to students who are unable to attend live classes. If anyone's looking to do, I often get asked about if there are some classes that you could do ahead of time. The university studies are ones that are offered kind of outside of the scheduling of our program. And so a lot of people choose to do some of those ahead of time just to kind of take away from a little bit of that heaviness when you first start the program. So year one, you would have communications 1000, health education, or HEED 1010, or English 1000. And then in year one, the winter term, you would have Psych 1060. And year two, the only one that's left is Sociology 2750. One cautionary thing that I always remind people is that if you're planning to do the PN program and are looking to have a full-time student loan, you need to leave at least 3 credits of university studies courses available to take in year one, term one. Otherwise, you'll be considered a part-time student from a funding purpose. So if you're looking to take some classes ahead of time, you're not quite sure what to take, you're welcome to always send me an email, or if you send it to the admissions email as well, they'll just send it on to me. And graduation requirements. And this one's important kind of in the long term, but maybe not so much today. So students must graduate with an overall GPA, grade point average, of 2.0. 2.0 works out to about 64%. If you don't have a 2.0 GPA, that jeopardizes your ability to graduate. And your instructor and coordinator, that's me, if we have concerns about your GPA as you progress through the program, we'll work with you and we'll see what we can figure out to help you be successful. There's a regulatory policy called academic standards of grades for a further explanation of academic expectations. All right, so that's lots of me talking. Does anybody have any questions? Oh, lots of typing. I'm so glad. Oh, you're very welcome, Kim. Oh, great question. So in terms of, oh, thank you. I feel okay. I'm just kind of a mess right now, but thank you. Does NLC accept credits from other institutions for the PN program? Yes, we do. What the criteria is that it has to be within the last 5 years if it's a nursing course. And we have to have a look at the course outline or the syllabus from the other institution and make sure that it meets the same learning outcomes as what our course does. And then, of course, we need your transcripts just to have a peek at your grades to make sure that it meets that standard as well. So if you have credits from other institutions that you would like to have assessed, just let me know and we can get you and the form that you have to fill out, and we can get that rolling for you well before September is actually a great way to do it. Are we able to choose or put in? Do you have my email, Nathoya? I'm going to pop it in the chat box. You do. Okay, perfect. Are we able to choose or put in requests regarding locations for placements and practicums from Vegreville? So yes and no. What we do is we ask people to put in their requests for your final practicum, but the instructor-led practicums are just because they go in groups, we're not as flexible with them. We're not going to Vegreville. What's the other V town that's closer to Vegreville? No. Vermilion. I think we're going to Vermilion this year for long-term care. I would have to double check on that though, but and so you're probably in the Lloyd cohort, right? Yes. Okay. So in the Lloyd cohort, typically there's for long-term care, we've had them in Lloydminster, and we've had a couple of outlying communities, Vermilion being one of them. And then so far, the acute care have all been at the Lloydminster Hospital. And I can't promise that nothing will ever change that way, but we've been pretty consistent with being able to use the Lloydminster Hospital. Yeah, it's great if we can keep people close-ish to home. We just always say there's a big caveat in the student handbook that we always say just be prepared to travel. we do our best, but some things are beyond our control sometimes. We're kind of at the mercy of the health systems. Drayton Valley. So Drayton Valley is I would say Slave Lake geographically is probably the closest campus to it, but we do have a couple of options. So in Slave Lake, when you do your labs, it would be once a week that you would be required to be in lab, and that would be for term 2 and term 3. High Prairie, we do it a little bit different. So High Prairie is about another hour and a half down the road, but we cluster our labs in High Prairie. So for those students that are from a little bit further away that want to do labs 1 week a month, give or take, what they do is they go to High Prairie and then they kind of cluster those labs together, but they don't have to come every week. So it's kind of up to you which one makes the most sense for you. Some people, if you're able to go and just stay there for the week, then it's a lot less driving for you. If you can't make that happen, but you feel like you could get to Slave Lake once a week, sometimes that's a better option for you. What determines the campus choice you get into? You do. So when you apply for the program, it'll ask you, there's a little drop-down menu, and it'll ask you which campus you would like to attend, and it'll give you those 5 communities that I had earlier in the slideshow. So just choose which one works for you. You're welcome. Great questions. There are some student housing. There's student housing in Slave Lake, and there is student housing in, I believe Gruard still has student housing, but I would need to confirm that. And so what happens is that you would contact student housing, and then you can decide with them what kind of an agreement you want to make, whether you want to do it yearly or for a month at a time, or whatever you want to do with them. But yeah, lots of students have found that if they want to just rent something to be there, and then they kind of have a touch point so that they're not worried about hotels or Airbnbs and all kinds of things when they're in town. Oh, you're very welcome. If you guys have any other questions, you're more than welcome to ask. If you think of something after we get offline, my email is all over our page online, and feel free to just send me an email.